great thing that we have in the London Osteotomy Centre, because this is the centre where the osteotomy guys of this world meet, but it's also the centre where we have lots of unicondylar replacements and quite some total joint replacements. And summing up our statistics, we have to see that we treat, I guess, most of our patients joint preserving, quite a proportion sacrificing or partially sacrificing. And these potentially in a ratio of 50% each. So half of the patients with full thickness defect that come to us that go for joint replacement would go for partial replacement. But there is also a proportion of patients coming to us with full thickness defect that would be applicable for an osteotomy. And obviously, as you already see and hear, is a delicate decision that you have to go through, and you have to be very, very precise in your indication criteria, and you have to translate these criteria to your patients in order to make them understand why you shoot for this one, that one, or that one. And it's way easier for the patient to follow the whole thing if he understands what he has, and if he understands or she understands your decision making. And this is what we try to build up in this center of excellence. And furthermore, we just not want to try to build it up. We want to try to pioneer each of these single steps. In terms of osteotomy, that does mean that annually, each and every year, we bring out novelties, surgical novelties, in terms of inventing things, improving the approach, improving the patient rehab, improving the instruments that we have by co-working with industrial partners. So we really try to pioneer that and bring it up. And meanwhile, the London Osteotomy Centre got international reputation and acceptance for being one of the centres in the world where this really happens, where we really transform experience into patient benefit.